All right, welcome back. We are now on task section 1.3, which is identifying medical terminology and abbreviations. There is nothing I can say, there is nothing that I will be able to do that will make you remember every abbreviation. In the group homes that I am affiliated with, when I am doing the medication record, I try to steer away from using abbreviations to decrease the risk of you having any type of errors. However, that does not mean that you may go into another home or into a jail setting or a daycare setting and they use abbreviations. So it is very important that you have a basic understanding of the different abbreviations that you may come encounter with. You will receive a list of these abbreviations, and it is very important that you get to know them, become familiar with them, because it is something that you will be tested on and you are responsible for being aware. The most popular one that you will see is PRN. And PRN means as needed. And that is how you give medication sometimes, as needed. So PRN is very, very important. Some of you may work PRN. So remember that PRN is as needed. There's no special way to remember it. It's just PRN. Another one that is very, very common that you will see is PO, and that means by mouth. That means the medication is given by mouth, or something that you are taking is by mouth. So PO. So PRN and PO are two that you will see frequently. A few others that you're going to see, and there's no way to memorize them other than just reading and memorizing. You have AC, which is before meals, okay? And a way to remember that is you're going to see AC and PC. A comes before P. So A is before meals, P is after meals. AC is before meals, PC is after meals. An easy one is ounce, OZ. Same thing that you use when you're measuring out your coffee or your water or whatever. Ounce, OZ, okay? They may have so many ounces they have to drink. There's another easy one, but you got to be able to identify it. It's SL. SL is sublingual, okay? That is when you are giving a medication and you're putting it under the tongue where it would dissolve. Now we have a couple of them that have to do with the time of medication administration. Remember that Q is every. Q is a Latin abbreviation for every, okay? So if I have Q1H, that is every 1 hour. The H is for hour. If I have Q2H, it's every 2 hours. A common one is going to be Q4H, which is every 4 hours, okay? So if Q is every and D is day, and you see QD, that is every day, okay? Another one you're gonna see, which I can only tell you that B, I think of bi-weekly or bi. So BID is twice a day. D, once again, being day. So B, you can think of it as the second letter in the alphabet. BID, twice a day. TID, well, how many times a day do you think that is? T, 3 times a day. Q, I know we said it's every, but this one, it's going to be for like quarter maybe. QID is 4 times a day, okay? And then you have QOD. Q is every, O is other day, QOD. HS is that hour of sleep. That means you are receiving a medication an hour before they go to sleep. And normally there's gonna be scheduled around 9 o'clock, 9 o'clock. And then we already spoke about PRN. So those are a few of the terminologies that you will have to be aware of. And then there's a few others that are pretty easy though. If you see CAP, CAP, capsule. TAB, tablet. Very easy, right? Now one that you won't ever see, or you don't see too often, but you have to know, GTT. Only thing I can tell you is memorize it. It's drop. They get 4 GTT in their eye. They are getting 4 drops in their eye. SOL is solution. You are to give them 5 mLs of this SOL solution. Topical, TOP. I don't know any other way to tell you other than TOP is topical. And then another one that you may see is ADR, which we don't want to see. It is adverse drug reaction, meaning something that is negatively happening to someone because of the medication that they took. Okay? And then you have TBSP, which is the same thing that you use in your house, is tablespoon. TSP, teaspoon. ml, milliliters. All of those are things that you're very common with. A couple of other ones that you're going to need to know and memorize. BP. Who knows what BP is? I know everybody has their hand up, right? BP is blood pressure. And a beautiful blood pressure, a normal blood pressure is 120/80, okay? T is temperature, 98.6. R is respirations, and that is how your breathing pattern is. And that normal is 12 to 20. Your pulse, which is your heart rate, which you can read on your radial. You can do your carotid, or you can do the brachial, and that is going to be 60 to 100. And all of these are VS. These are vital signs, okay? Now, if I say, ooh, she is SOB, what would you think? No, it's not a cuss word. No, I wouldn't say that. It is short of breath, shortness of breath, SOB. Ooh, what is this one, guys? BM. She had a big BM. It's very important to keep up with that, and they should go at least every 3 days. Bowel movement. And then I'm pretty sure we all know this one. Oh, she had to void. Void is urinate. Okay? Alrighty. So we are ending our abbreviations. Please take the time to review this. Please listen to the different tips that I gave you and ensure that you become comfortable with them.